September 20th is World Gynecology Oncology Day. So this day is meant to bring awareness among people about ovarian cancer, endometrial cancer, cervical cancer, vaginal cancer, which are the cancers which are among women. So it's mainly about the genitourinary tract, and we will be talking about that. So ovarian cancer is a cancer which is not very common in women compared to cervical cancer in India. But still, nevertheless, it's a common cancer. And this cancer is something which comes without notice. It's considered as a silent killer because 80% of the patients present in third stage. And when they come in extension, and most of the time, the survival decreases because of the low presentation. So we consider it as a silent killer. Now, why this cancer particularly comes nobody knows, and it can affect any age, and younger age group, and older age group. Most of the time, we see these cancers in women over the age of 60 years. So they generally present with distension. They will have no particular or specific symptoms. They assume that they are gaining weight as such because their tummy is becoming big. Enough women will come and tell us like, it's because I thought I'm gaining weight, but as such, it is a tumor which is growing inside the abdomen. So it's very imperative and important for women to understand this, that whenever their abdomen distends and they are not consuming so much food or it is happening suddenly, it is very important for them to go and show it to a gynecologist, because that is where we can pick it up early. Apart from that, there are some screening programs, especially women above the age group of 50 years. Once in a year, they have to go for an annual health checkup. Most of these tumors grow to large sizes, and we have operated tumors of 25 kgs, 30 kgs. So they can grow, and this is because of the neglect at times. Patients consider that it's normal to have a distended abdomen, especially among the low socioeconomic status. So we say that because the equitable distribution of health these days, and government has come up with good programs like the Ayushman Bharat, where there is equitable distribution even for people who cannot afford to belong. So we always recommend that any patient who has got distension of abdomen and somebody finds it out, it's always better to put them to the hospital. In that way, we can help that particular person. So generally, we do surgery, and these surgeries are again complex surgeries. It's not like just a tumor should not spill, it should not go anywhere. So it should be removed in a particular way. And there are some complex procedures for cytotension. We go along the path of the spread of tumor and take them before it comes over there. And the same thing applies like we have systems like HIPEC and IPEC or IPEC. So all these treatments do make a difference. And going to the treatment is pretty important in a proper way. And we would recommend that all the patients should go to oncology centers for ovarian cancer treatment. And the gynecologists will definitely help them to do that, because this requires the collaboration of a gynecologist, a surgical oncologist, or a gynec oncologist, and for surgeries, and a medical oncologist for chemotherapy. And working as a team will give the best result for the patient. And I hope this message will go to everyone that even if there is a woman who has a distension of abdomen for no good reason, then they have to go and meet a gynecologist for getting treated. There could be a possibility that it could be a ovarian cancer, especially among women in their 50s.